Hi, everyone. My name is Rachel Ryan,
And my name is Fred Arthur Fisher.
and we're going to share some information about accent modification.
The group we would be presenting to is low socioeconomic status. And before we begin, it's important to understand the difference between an accent and a dialect.
An accent is the unique way that groups of people who speak the same language sound.
And a dialect is a variation of a linguistic symbol system used by groups that reflect and is determined by shared regional, social, and cultural ethnic factors. So talking like this is in an accent.
But saying yonder or further with the same prosody is a dialect.
Saying further is perfectly fine. Saying further is a dialect. There are two common groupings of dialects. There's regional dialects and national origin dialects.
Regional dialects are shared among people who come from different parts of their country. So people who are from East Texas often sound different than people who are from New York, or people from London often sound different from people who are from Scotland.
National origin accents are sometimes heard in people who learned English as an adult. Someone who speaks only English may sound different than someone from France who speaks English as a second language.
So why would anyone want to change their dialect?
Sometimes it's clients whose second language is English and they feel their dialect makes them difficult for native English speakers to understand.
Some might want to learn to communicate in different social or professional environments.
And some might be actors learning an accent for a role, or people who just want to sound differently than they do. The reasons for learning a new dialect are as varied as the reasons for learning a new language.
As we talk about accent modification, it's important to understand this is inclusive to all cultures. Each culture is unique, and every culture's dialect says a lot not just about the individual, but about their culture. Although people may struggle with a particular accent in a new environment, any SLP is able to preserve the culture and the dialect as much as desired.
This is a particularly sensitive topic, as the group most likely to benefit from accent modification is those of low socioeconomic status.
Because one's dialect says so much about one's background, it can serve as a shorthand for judging things with dialect has no bearing on.
For instance, if a television program would like to portray someone as stupid without showing it, they can simply give them a Southern accent. They made entire television programs based solely on this premise, like the Beverly Hillbillies.
And that's one of the more socially acceptable forms of judgment based on dialect. Too often, those from low socioeconomic backgrounds are judged to be unintelligent, unskilled, and ill mannered based solely on how they speak.
Even tests that we SLPs use in assessment, such as IQ test or a Woodcock-Johnson assessment, are deeply dependent on very specific dialectical cues, which do not necessarily translate from region to region, much less from country to country.
Non-mainstream dialect use is associated with weaker literacy achievement.
And that's just the standardized form of discrimination those with non-mainstream dialects face.
Evidence suggests that applicants who have standard American dialect are far more likely to be given a job and academic placement over applicants with objectively better qualifications. There was a study that showed that German workers with distinctive regional accents earn 20% less yearly than workers with standard accents. And in another study, 8 in 10 employees admitted to making discriminating decisions based on regional accents.
Given the difficulties those with non-mainstream dialects face, it is of enormous benefit that they be taught code switching to standard American. This can be met with resistance as it runs into some cultural sensitivities.
Many view their dialect as deeply ingrained and important part of their culture heritage. Attempting to code switch to a more mainstream standard American can be seen as a form of cultural betrayal.
It can also be seen as inauthentic, as the standard American dialect is associated with a hegemonic monoculture with no identity of its own. A person from East Texas or with an East Texas dialect has a rich cultural heritage. A person with a standard American has none. While they're viewed as more successful and more intelligent, they're also viewed as bland.
So it's important to impact to the target population that gaining a new dialect does not mean getting rid of their previous one.
SLP should emphasize that everyone already has multiple dialects that they use all the time when they're code switching in their daily lives. Teaching accent modification as controlled code switching rather than removing a previous dialect can show cultural sensitivity as well as remove barriers of cultural gentrification from accent modification. Being able to code switch is the key to economic and social mobility.
And everyone should be proud of where they come from, but when someone's accent comes in the way in social situations, social school or work, some may become frustrated. People may not understand your accent and ask to repeat yourself several times. This can cause people to want to modify their accent. Speech language pathologists are able to work with the client to change as much of their accent as they want. As the accent may be important to one's culture, the SLP needs to be informed so this aspect of the accent will not be changed. Not only does the SLP work on phonemes with the client, but they could also work on stress, pitch, loudness, intonation, and timing.
The primary way that an SLP helps with accent methods, they would be the same way that they use to treat an Arctic disorder. Certain dialects raise and lower vowels. Things such as Canadian raising vowels is why they might pronounce house as hoose. Northern Irish accent lowers vowels, making can't. And a Boston dialect will deroticize, while Southern dialects assimilate final consonants.
An SLP may take a language sample and begin to modify the client's articulation in isolation before moving to words and sentences.
They may also ask the client to just read a sample in order to modify the dialect, not just in a naturalist environment, but to modify it if the client's goals are to give her prepared marks in a group setting, like a public speech.
There are training strategies SLPs use to modify accent, and some could be something like listening and imitating, which is really straightforward as the client imitates the clinician.
Another interesting strategy is to use tongue twisters. Your clinician will ask the client to produce phrases that are difficult because of the use of successive consonants in words, such as toy boat, toy boat, toy boat, toy boat, toy boat.
Now you want to do a hard one?
Like imagine an imaginary menagerie manager imagining an imaginary menagerie, or more something like to sit in solemn silence on a dull, dark dock in a pestilential prison with a lifelong lock, awaiting the sensation of a short, sharp shock from a cheap and chippy chopper on a big black block.
Where did you learn to do that?
Accent modification.
As we mentioned earlier, vowels may be raised or lowered in different dialects. SLPs can work with the clinician to practice the vowel production and altering the stress patterns within it. Phonemes can also be worked on in a similar manner, as the SLP can teach articulatory positions for treble phonemes.
Accent modification goals are typically to improve intelligibility to an unfamiliar speaker and to allow the speaker to communicate effectively.
It's important to know that accents are not a speech or language disorder. As such, it is not covered under Medicaid or forms of insurance. This makes most interprofessional components to accent modification minimal.
The most obvious interprofessional component would be from social workers. Many find that their low socioeconomic status clients have more difficulty finding work, even if they have all the necessary professional qualifications. This can often be solely due to dialect. It's a form of discrimination that is both legal and commonplace.
Working in conjunction with a social worker, an SLP teaching accent modification can be given a clear set of goals about what the client hopes to achieve professionally.
Social workers also tend to have English as a second language clients whose dialects make it harder to understand. Working in conjunction, an SLP would know the client's goals are not simply professional, but also social in nature and might involve some forms of pragmatic language.
Perhaps the best way SLPs can help with accent modification is with education to those within low socioeconomic background.
Some, especially young people, might be unaware of how their dialect might be judged or that code switching from their dialect is commonplace.
Education of the general public can be achieved through community outreach, but educating other professionals is also important as they have more contact with the target population than SLPs do.
This is likely where the most interpersonal component will occur. SLPs have contact with nearly every other professional organization in therapy and education. And by educating these professionals about accent modification, we can expose more of the target population than we ever could through individual interaction.
So, teaching accent modification is not about teaching clients the right way to talk. It's about giving them a choice in how they want to talk.
The truth is, there is no right way to talk. Do you remember hearing a dialect like this while maybe watching an old movie? This is called a transatlantic accent. It used to be taught to people in movies and public speaking as the right way to talk.
But it was not a naturally occurring dialect. No one spoke that way in a naturalistic environment. Attempting to fix someone's dialect or teaching the right way to speak ends up making their speech production forced, which is not what accent modification is trying to teach.
Accent modification is about giving clients a choice, just like teaching them second language, to help them better communicate any way they choose.
And helping clients communicate is at the core of what we do.